Hi, my name is Dr. Jannell Lising, and I'm a physician with St. Joseph's Hospital. In this video, we hope to answer some of your questions about the COVID-19 vaccine. First thing, what is COVID-19? COVID-19 is a virus that spreads very easily from person to person. That is why it has made so many people sick over the past year. This virus spreads by droplets. Droplets are created naturally when we talk, sneeze, or cough. If a person is sick, these droplets have bits of COVID-19 virus in them. Droplets get into the air, but they also fall onto surfaces like tables, chairs, and door handles. They can get anywhere. When someone touches a surface that droplets have landed on and then touches their own face, this can get the COVID-19 virus onto their body. This moving of the virus from surfaces to people is one reason hand washing is so important. You may know people who have gotten sick with COVID-19. These are just some of the symptoms of the COVID-19 virus, such as cough, shortness of breath, fever, diarrhea, loss of taste or smell, and sometimes both, and headaches. Unfortunately, new strands of COVID-19 are emerging. Viruses like COVID-19 change over time. This is what causes new strains of the virus to be created in different parts of the world, just like it shows on this map. The longer the COVID-19 virus stays at high rates in humans, the more chances it has to develop into many different strains. How does the COVID-19 vaccine work? So far, 2 vaccines have been approved for safe use. These are made by Pfizer and Moderna. About 70,000 people participated in clinical trials. Clinical trials are there to test the safety of vaccines and see how well they work. These 2 COVID-19 vaccines work extremely well. The Pfizer vaccine is 95% effective, and the Moderna vaccine is 94% effective. Both of these vaccines work very well. If you think about grades in school, getting a 95 or a 94 is always an A. Basically, these vaccines earned A's in the clinical trials. Because of the trials, we know these vaccines are safe and effective. For the COVID-19 vaccine to work, a person needs to get 2 shots in the upper part of their arm. The second shot needs to be done 3 to 6 weeks after the first one. The time between shots will depend on whether or not you get the Pfizer or Moderna vaccine. One thing that people have been confused about is what is in the vaccine. There is no live COVID-19 virus in the vaccine. The scientists have studied the genetic information from the virus to create the vaccines. What the vaccine does is that it teaches your body's immune system how to fight the COVID-19 virus. That way, if the real virus enters your body, you will not get sick. This is how the COVID-19 vaccine works. The COVID-19 vaccine does not contain a dead or weakened virus. Instead, it has a genetic instruction manual that tells your immune system how to respond and protect if the COVID-19 virus gets into your body. The technology used in the vaccine is not new. It is called mRNA, which stands for messenger RNA. This technology has been studied for use in vaccines for decades. This is the first time this messenger RNA has been used in a vaccine, but the vaccine will work just like other vaccines to protect you from getting sick. Now we're going to talk about some common concerns and worries that some people have about the vaccine. Some people have asked, can the vaccine give me COVID-19? The answer is no, that is not possible. The vaccine does not contain any forms of live, dead, or weakened COVID-19 virus. Nothing will enter your cells, and the vaccine parts are broken down after they do their job teaching your immune system how to fight the virus in your body. Nothing in the vaccine can change your DNA. Some people are nervous that this is the first type of vaccine that uses mRNA. Even though this is the first vaccine with mRNA to be released, this type of technology has been researched for the past 20 years. This type of vaccine has been studied also for creating new medicines to help people with HIV. Another thing that we've heard that people worry about is that the vaccine was made so quickly. The COVID-19 vaccine has been approved by the FDA, or the Food and Drug Administration. Another great thing is that modern tools and technologies allows us to develop new vaccines faster than in the past. COVID-19 is also caused by a coronavirus, which is a type of virus. There are other types of coronaviruses, and people were already working on vaccines for the other coronaviruses. The fact that there was already work being done with trying to make vaccines for other coronaviruses gave us a big head start. There is also a worldwide effort and lots of funding to help speed up the vaccine development process. This cooperation was new, and it helped speed up all of the process a lot. Because so many people were getting sick and dying, companies, governments, and universities from every country worked together and used the most advanced technology to make the vaccine as quickly as possible to save lives. The vaccine clinical trials also had a very large number of people participating. People of different ages, ethnicities, and with different medical conditions. About 70,000 people participated in the vaccine trials. All of this helped to make the vaccine developed and approved more quickly. Some people have said that they aren't sure that they want to get the vaccine because they heard that their life will not go back to normal right away once they get the vaccine. The good news is that when enough people are vaccinated, life will become normal again. For that to happen, though, we will need to get everyone vaccinated that is able to do so. The goal of the vaccine was to decrease deaths and hospitalizations from COVID-19. When enough people are vaccinated, this will lead to less passing of the virus from person to person. This process will help the pandemic end sooner with fewer lives lost. Just to reiterate, remember these important things. You cannot get COVID-19 from the vaccine. The vaccine does not do anything to change your DNA. Both of these rumors have been spread all over the internet and widely in many communities. Some people think that they shouldn't get the vaccine if they've already had COVID-19. Even if you have had COVID-19, you should still get the vaccine. You just need to wait after you are recovered from your illness to get it. For those who've had COVID-19, wait at least 10 days after the day you got sick to get vaccinated. You want to make sure that it has been at least 24 hours since you last had a fever and after you haven't used any fever-reducing medicines. Let's go over the phases that the vaccine will be distributed to everyone. These recommendations from the CDC, which is the Centers for Disease Control. The first phase is 1A. This is the first group to get vaccinated, and it includes healthcare workers and anyone who lives in a long-term care facility like a nursing home. The second phase is 1B. The second group to get the vaccines happens in this phase. These people are essential frontline workers like those who work in grocery stores and places where they interact with many people. This group also includes people with high-risk medical conditions like cancers that are immunocompromised or undergoing chemotherapy and diabetes. This third phase is 1C. In this phase, people who are about 65 and 74 will get the vaccine, in addition to people between 16 and 64 with certain medical conditions and any essential workers who have not yet gotten a vaccine. Let's talk about the possible side effects of the vaccine. These side effects occur in some people, but not all people. It is important to remember that some side effects are normal in any type of vaccine. Because the vaccine is turning on your immune system, it needs to teach your body how to fight against the real COVID-19 virus. For the COVID-19 vaccine, there are some possible mild side effects that could happen very soon after the vaccine shot is given. The site of the shot can be sore, and some people may have a fever, feel tired, or have a headache. This can be treated with Tylenol or putting a cold, clean, wet cloth on the site where the vaccine shot was given. A much more rare side effect is an allergic reaction such as hives, swelling, and wheezing. To watch out for this, people are asked to wait 15 to 30 minutes after getting the vaccine. Healthcare professionals are on site with medications needed to stop allergic reactions if they happen. Some people experience more side effects after their second dose than the first one. Much more rarely, people can have more moderate or severe reactions. This is why doctors are on site at vaccination stations to help if anything should happen. The possible severe reactions are things like anaphylaxis, which is a severe allergic reaction. Symptoms of this severe allergic reaction are swelling in the face or neck, difficulty breathing, rash, and a very fast heartbeat. These things can be treated with medications that doctors have at the vaccination sites. Another very rare side effect is called Bell's palsy. This is a mild numbing and paralysis of the face. Very rarely, fainting and dizziness can also occur. Just a few things to go over. After getting the vaccine, it is important to still maintain proper social distancing, such as wearing face masks and washing your hands. For women who are pregnant or plan on becoming pregnant, it is important to know that studies still have not been done about the effect of vaccine in this group of people. Lactating and breastfeeding women can choose to get the vaccine if they work in healthcare, and mRNA vaccines are not known risk factors for infants. The Pfizer vaccine was not tested in patients younger than 16 years old, and the Moderna vaccine was not tested in patients younger than 18 years old. This is why kids are not eligible to get these vaccines yet. It is not because it is unsafe for kids, it's just because it hasn't been tested in them yet. Those who have a history of severe allergic reaction should let their provider know so that the necessary precautions can be taken. They may still be able to get the vaccine, but may have to be watched more closely after getting the shot. People who have mild allergies should not have a problem with the COVID-19 vaccine. Thank you so much for your time, and these are the resources we use to share this information with you.